Anti-Müllerian hormone, AMH, plays a significant role in polycystic ovary syndrome, PCOS, females undergoing in vitro fertilization, IVF, treatment. What is AMH? AMH is a hormone produced by the ovaries, reflecting the number of antral follicles, immature eggs. Role of AMH in PCOS. 1. Diagnostic marker. Elevated AMH levels, greater than 3.5 nanograms per milliliter, are common in PCOS, indicating multiple small antral follicles. 1. Greater than 3.5. 2. Ovarian reserve. AMH correlates with ovarian reserve, predicting response to fertility medications. 2. 3. Follicular development. AMH inhibits follicular growth, potentially contributing to anovulation in PCOS. 3. AMH and IVF in PCOS. 1. Predicts ovarian response. AMH levels help estimate the number of eggs that will be retrieved during IVF. 1. 2. Guides stimulation protocol. High AMH levels may require adjusted stimulation protocols to avoid over-response. 2. 3. Egg quality assessment. AMH doesn't directly predict egg quality, but high levels may indicate a higher risk of poor egg quality. 3. 4. Risk of OHSS, ovarian hyperstimulation syndrome. Elevated AMH increases OHSS risk. Careful monitoring is necessary. 4. Interpretation of AMH levels in PCOS. Low AMH, less than 1 nanogram per milliliter, poor ovarian reserve, reduced IVF success. Less than 1. Normal AMH, 3.5 nanograms per milliliter, good ovarian reserve, favorable IVF outcome. 3.5. High AMH, greater than 3.5 nanograms per milliliter, increased risk of OHSS, potential for multiple follicles. Greater than 3.5. Clinical considerations. AMH alone is not definitive for PCOS diagnosis. 2. AMH levels fluctuate, repeated testing may be necessary. 3. Other factors, age, BMI, hormone levels, influence IVF success. 2. 3. IVF treatment strategies for PCOS with high AMH, mild stimulation protocols. 2. Gonadotropin-releasing hormone, GnRH, antagonist protocols. 2. 3. Embryo freezing for future transfer. 4. Consideration of IVF, in vitro maturation, or natural cycle IVF. 3. 4. PCOS and IVF. 1. IVF success rates, 40–50% per cycle for women under 35, decreasing with age. 1. 35–40–50. 2. Common IVF protocols, GnRH agonist or antagonist, with or without ICSI, intracytoplasmic sperm injection. 2. 3. PCOS-specific considerations, risk of OHSS, multiple pregnancies, and ectopic pregnancies. 3. AMH and IVF predictors. AMH less than 1 nanogram per milliliter, poor ovarian response, reduced IVF success. 2. AMH 3.5 nanograms per milliliter, good ovarian response, favorable IVF outcome. Less than 1. 2. 3.5. 3. AMH greater than 3.5 nanograms per milliliter, increased risk of OHSS, potential for multiple follicles. PCOS treatment options. 1. Medications, clomiphene citrate, letrozole, metformin. 1. 2. Surgical options, ovarian drilling, laparoscopic ovarian cauterization. 2. 3. Lifestyle changes, weight management, exercise, stress reduction. 3. IVF stimulation protocols for PCOS. 1. Mild stimulation. Lower gonadotropin doses to reduce OHSS risk. 1. 2. GnRH antagonist, to prevent premature ovulation. 2. 3. ICSI, to improve fertilization rates. 3. PCOS and egg quality. 1. Egg quality affects IVF success. 2. AMH doesn't directly predict egg quality. 1. 2. 3. Other factors: age, BMI, hormone levels, and oxidative stress. PCOS and embryo transfer. 3. 1. Single embryo transfer, set, recommended to avoid multiple pregnancies. Blastocyst. 2. Blastocyst transfer, improves implantation rates. 3. PGS, PGD, pre-implantation genetic screening, diagnosis, optional for genetic testing. New developments in PCOS and IVF. 1. In vitro maturation, IVM, of oocytes. 2. Ovarian rejuvenation techniques. 3. Personalized medicine approaches. 4. PCOS diagnosis and management. 5. IVF protocols and success rates. 6. AMH and ovarian reserve. 7. Egg quality and embryo transfer. 8. New developments in PCOS. New developments in PCOS and IVF. 1. In vitro maturation, IVM, mature eggs in vitro, reducing stimulation needs. 2. Ovarian rejuvenation, experimental techniques to awaken dormant follicles. 3. Personalized medicine, tailored treatments based on individual hormone profiles. 4. Genetic testing, pre-implantation genetic screening, PGS, and diagnosis, PGD. 5. Stem cell therapy, research on using stem cells to improve ovarian function. 6. Non-invasive stimulation, using medications to stimulate ovaries without injections. 7. Egg freezing, elective egg freezing for future fertility. 8. Mitochondrial replacement therapy, MRT, replacing damaged mitochondria. 9. Next generation sequencing, NGS, advanced genetics.